Hi, my name is Caitlin Catarzoli, licensed esthetician at ReFresh Aesthetic Center, and I want to educate you on the importance of skincare treatments and products in your 20s. Now, our skin goes through so many dramatic changes from our teens into our 20s. So once we hit our 20s, we really want to make sure we're using appropriate medical grade skincare products and then also coming in for medical grade skincare treatments as well. Now, some products that we highly recommend once you get into your 20s would be an exfoliating cleanser. We want to make sure we're exfoliating but not over exfoliating. We want to make sure we're using a medical grade vitamin C. That'll help with brightening the skin, evening the skin tone, helping prevent and correct any sort of sun damage. And that's just in the morning. And then at night, we want to be using some sort of retinol, and that helps with cell turnover rate. And as we mature, our cell turnover rate slows down. So we want to make sure we continuously have those new, fresh skin cells. And then as far as injectables go, just starting slow would be, some Botox and then possibly some lip filler as well. Now, skincare treatments that your skin will highly benefit from would be our hydrofacial, our diamond glow, some light peels, microdermabrasion. And those are just some of the things that your skin would highly benefit from. Everything's customizable, personalized, and tailored to you and your skin. Let us customize a treatment plan for you.
I'm going to talk you through a recommended skincare routine for an individual in their 30s. I can't stress enough creating an established relationship with your esthetician so they can understand your specific skincare needs, but I'm going to kind of extend to you what I would recommend for a general 30-something. There are two main contributors that are happening to the skin as we move into our 30s. One is cell turnover slows down, and two, collagen production slows down. So you'll see a tie for some of the products that I'm using that helps kind of combat those two things that are happening within our bodies and within our skin. So first starts with cleansing the skin. I recommend a gentle cleanser or something that's doing like a gentle exfoliation. After a cleanser, you'll move towards an antioxidant. Antioxidants help protect the skin and help protect the skin from the sun. Then from your antioxidant, you'll want to utilize a great sunscreen with an SPF 30 or higher. I love a tinted sunscreen because it helps blend some of my pigmentation imperfections. Now for your evening routine, again with your cleanser, either gentle or exfoliating depending on your skin type. Then you'll move towards a retinoid. A retinol helps induce cell turnover. How I describe retinoid use is in your 20s, you use it 2 nights a week, your 30s, 3 nights a week, 40s, 4 nights a week, and onwards. Now, this is something that you want to walk before you run in terms of use because again, it's inducing that cell turnover, bringing fresh cells to the surface of the skin. Lastly, you'll want a great moisturizer in your evening. You can use something that's hydrating or something that's a little bit more moisturizing. And again, that would be tailored to your specific skincare. Now, in terms of treatments, great to incorporate your microdermabrasion, dermaplane for exfoliating some of that dead skin that's sitting on the surface of the skin. I love a great BBL treatment for evening out skin tone. You can move towards laser hair removal in order to maintain the health of the skin. In terms of injectables, right now is a great time to be utilizing preventative Botox. This helps prevent those fine lines and wrinkles from forming, and 30s is a great time to start that. You can also look towards filler treatment in terms of adding volume and creating contour to specific areas that you're looking to target. We're here to help you achieve your skincare goals.
At the age of 40, it's very important to come up with a personalized treatment plan and products for your skin's need. At this age, we start losing collagen production, so we lose volume of our skin, and we start getting red spots, brown spots, wrinkles begin to show, and we lose firmness of our skin. So it's very important to start treating your skin with products such as growth factor and retinols, and even to meet with a nurse practitioner who can talk about injectables, because this way we can really slow down the signs of aging, and we can make your face look a little bit more youthful than it is right now. There are also procedures that you can do. You can do a procedure called BBL. This light treatment is very anti-aging, stimulates collagen growth, but also it will help remove those aging spots such as redness and pigment that make our skin look older than it is. There's also microneedling, there's therapy treatments to tighten our skin, and also there are facials and peels that will help you look more youthful. So please give us a call at ReFresh Aesthetic Center so we can arrange your complimentary consultation or a virtual call to come up with a treatment plan and products for your needs.
Let's talk about skincare in your 50s and beyond. I can speak to that very well based on personal experience and from treating many of my clients in this age group. The first thing to consider is what you're doing for your skincare. As we age, whether we're in menopause or postmenopausal, that's one factor. We have a decrease in our estrogen that decreases the hydration to our skin. We lose hyaluronic acid in our skin, and that hydrates the skin. We also have a thinning of our dermis or our skin due to loss of collagen and elastin. And then finally, we also have volume loss. So fat pads are intricate throughout our face, and as we age, we have a loss of fat compartments that need to be restored and kind of a descent of the fat pads. So all that being said, the first core thing to do is start with a clinically based skincare regimen. I personally love, I'll share with you my personal products, and that the first is vitamins for your face, which is TNS Advanced Plus. This product by SkinMedica is the next generation growth factor, along with peptides and antioxidants. I love this product and recommend it to all of my patients. This is core collagen building. That's what growth factor does. It builds collagen. So think of it as vitamins for your face. Additionally, we're all exposed to environmental damages as well as blue light. So the Lumavive system has a morning, a daytime, and an evening product. And here our daytime product is going to help us with high-powered antioxidants to protect from those environmental damages. The nighttime product is going to help restore our skin's process, which really is revved up during the early morning hours. Also, hydration, as we talked about, is so important. So HA5 is a time-released hydrating serum. I use this daily. I use it twice a day, and it provides that hydration base under my moisturizers. Moisturizers are important, and we have a wide array of moisturizers that are really customized to your skin needs. So within our Revision, our SkinMedica line, and our SkinCeuticals line, we can pair a product right for you. Retinol is very important at any age, but especially in our 50s and beyond, because we want to increase the cell turnover rate in our skin so that our products penetrate better and so that we have healthier skin, improved texture to the skin as well. Eye products. I am a big one about eye products because I treat with Botox and Dysport all day long, and we can do a lot with those products. But in addition, we want to address the topical changes, some of those little fine lines that are occurring that sometimes are just due to lack of hydration, or just the textural changes that we can improve beyond Botox and Dysport with our skincare products. My two favorites are Revox 7, which is a high peptide 7 peptide serum that can be used on any expression lines. I especially like it around the eyes, and DEJ Eye Cream, my two personal favorites. Sun protection. We know this is key in one of the number one anti-aging products at any age and stage. And so we have a wide variety of medical grade sun protection products, again, that we can match to your needs. Personally, I love IntelliShade. It's a product I use not only as my sun protection and moisturizer, but also as kind of my daily makeup base, especially with using masks these days. I don't bother with my foundation unless I have something to get ready for. Also, and again, this is a must in our 40s, sometimes even starting our 30s and beyond, Nectifirm Advanced. This is wonderful for the neck and décolleté, a true essential twice a day. And we're thrilled to now have not only Nectifirm, but for those of you ladies my age, we know we're seeing changes at our elbows, our arms, the tops of our knees, our inner thighs, where that skin is texturally little more lax, even if we're working out. So Body Firm is excellent for that by Revision Skincare. I use this twice a day and I'm really seeing changes, especially in my arm area. Also, Latisse. I am only using Latisse these days. Went into quarantine and decided I was going to really rev up my lashes with Latisse. Started using daily use, and now voila, this is the only thing I use, with a little lash lift and tint procedure done by one of our estheticians as well. So that's part of my skincare regimen and beyond. But as far as this moving beyond the skincare, we need to also think about how to address those expression lines. We still want to express, but we want to quiet those muscles working overtime around our eyes, between our brows, our furrowing, our number 11s, the forehead, and we use Botox and Dysport even beyond in the lower face, the frown muscle down in the lower face here, your neck, the lips. There are a lot of indications for Botox and Dysport. So that's my number one injectable treatment that I recommend starting with. If you haven't started on your aesthetic journey with injectables, that is a great place to start. Additionally, we use a whole portfolio of fillers from both Allergan and Galderma, the two leading manufacturers for aesthetic injectables. And we really customize that to what your needs are. I think one of the most important things to start with if you are in your 50s and beyond is to restore some of that volume loss and descent of the mid-face. When we go from that inverted triangle of beauty in youth to the trapezoid of terror, as this starts to come down and give us more of a squared face, we want to restore that by re-supporting the mid-face. It doesn't mean your face looks fat or fuller, it means it's going to look more contoured. At the same time, we typically want to give a little support in the lower face. We can even work into the jawline. We now have a new indication for Voluma to the chin and for jawline enhancement and contouring. We use Kybella, which is an injectable agent, or Cool Sculpting for neck fullness and for just contouring the neck. So a wide variety of things we can do with dermal fillers today. We really use it as our artistic tool. It's not just meant to fill in lines and folds anymore. We think three-dimensionally, and that's how we treat with fillers. Whether we're enhancing something like the lips, restoring the lips because we're starting to see changes in lip lines and loss of structure to the lips, it really just depends on what your personal needs are. So a lot of information, all things to consider when we're in our 50s and beyond. But where do you want to start? You want to start with a customized, personalized consultation with one of our certified aesthetic nurse specialists and nurse practitioners for all of your injectable needs. Additionally, we often couple that with a consultation with one of our licensed estheticians who can talk to you about all of the skincare, as well as the wide array of topics I didn't speak to, which are all the medical-based skincare treatments, whether that's Diamond Glow, which is one of my new favorites, Hydrofacial, microneedling with or without platelet-rich plasma. We have profractional and microlaser pill treatments, which help with texture of the skin, scarring, smoothing out some of those deeper lines that may not be able to be addressed with the injectables, and body contouring as well. So start with that personal consultation here at ReFresh, whether it's virtual or live, and we promise to give you a customized treatment plan that's right for you.
At ReFresh, our patients are our number one priority, and we created a skincare club for our loyal skincare patients. I'm going to talk you through what it entails and the savings it involves. We have a 12-month program and a 6-month program. Our 12-month program includes add-on services that are PCA peels, Hydrofacial, Diamond Glow, facials, microdermabrasion, and dermaplane. The 12-month option is $50 per month, so $600 per year, and that includes $960 in savings for our refreshers. What is included in the Skincare Club option? One free add-on service per month. You can add the neck, the décolleté, or the hands for your treatment. One free microdermabrasion or dermaplane every quarter. 15% off skincare treatments, the ones that I mentioned, and then 15% off all products all year long. We also have special promotions for our Skin Refreshers and gifts with purchase, and then event-only pricing for our Skin Refreshers. Now that's our 12-month option. For the 6-month option, patients will pay $60 per month or $360 for 6 months. Same as the 12-month option. If you pay this upfront, you'll receive an additional 5% discount. Now, with this membership, patients will receive 1 free add-on area of treatment per month. That can be the neck, décolleté, or hands. 2 free microdermabrasion or dermaplane add-ons per membership. 10% off any single service that I listed earlier, and 10% off all medical grade skincare products and makeup. Lastly, Skin Refreshers will receive exclusive offers and special gifts as their 6-month membership continues. We can't wait for you to be a Skin Refresher.